Well, hello viewers, good evening and welcome to this bulletin. I'm KV Nurmi. Here are the headlines. Nagaland records first COVID-19 positive case. Patient admitted in Assam. Parents and family members of the patient undergo necessary tests. Members of the joint family of the patient have already been shifted to government quarantine center. Areas where the patient resides have been sealed, including the hospital where the patient was being treated. Doctors, nurses, all other staff and their family members who came into direct or indirect contact with the patient will be quarantined. Contact tracing have been started for all those passengers who were on the same flight taken by the patient. COVID-19 death toll in India rises to 308 cases to 9,152. And Assam report another COVID-19 positive case related to Nizamuddin religious congregation in Delhi, taking the state tally to 30. Now the details. We start off this bulletin on a grim note with this news that Nagaland has recorded its first case of COVID-19 with a patient admitted in Assam's Guwahati Medical College and Hospital tested positive for the coronavirus on Sunday. Addressing media persons at Guwahati today, Assam Health Minister Himanta Biswa Sarma said that the patient who was referred to Guwahati from a private hospital in Dimapur in Nagaland was found positive and is undergoing treatment at Guwahati Medical College and Hospital. According to the minister, the patient is a resident of Dimapur and was referred directly from Nagaland. He was first admitted in a private hospital in Dimapur, and when he showed symptoms for COVID-19, he was sent to GMCH.
ব্যক্তিগৰাকী আমাৰ অসমৰ স্থায়ী বাসিন্দা নহয় আৰু তেখেত নাগালেণ্ডৰ বাসিন্দা তেওঁৰ নাম হ'ল ৰাজা জয় আৰু তেওঁৰ বয়স 33 বছৰ তেওঁ 24 তাৰিখে কলিকতাৰ পৰা ডিমাপুৰলৈকে গৈছিলে ডিমাপুৰত তেওঁ দুজন ডক্টৰক তেওঁৰ অসুখৰ বিষয়ে দেখাইছিলে তেওঁ ব্লাড টেষ্টটো কৰা হৈছিলে কিন্তু কোভিড টেষ্ট কৰা হোৱা নাছিলে যোৱাকালি ৰাতিপুৱা আমি গুৱাহাটী মেডিকেল কলেজত ৰাতিপুৱা 8টা বজাত তেওঁৰ আমি চেম্পল কালেক্ট কৰোঁ আৰু গধূলি 9টা বজাত স্ক্ৰিনিং আৰু কনফাৰ্মেটৰী টেষ্টৰ পিছত তেওঁ পজিটিভ বুলি ডিক্লেয়াৰ কৰা হয় আৰু লগত দেউতাক আছিলে আমি দেউতাক আৰু ড্ৰাইভাৰ দুইগৰাকীকে আমি মহেন্দ্ৰ মোহন চৌধুৰী চিকিৎসালয়ত কোৱাৰেণ্টাইন কৰিছোঁ আৰু জয় যিগৰাকী অসুস্থ হৈ আছে তেখেতক আমি জিএমচি আইচিউত আমি ভৰ্তি কৰিছিলোঁ যদিও তেওঁক কোনো ভেণ্টিলেশ্যন ছাপৰ্ট দিবলগীয়া হোৱা নাই কিন্তু বহুদিনৰ পৰা চিমটমত থকাৰ বাবে ডক্টৰসকলে সাৱধানতাবশতঃ তেখেতক আইচিউত ৰাখি থৈছে যদিও আইচিউত কোনো ধৰণৰ আইচিউ ছাপৰ্ট দিবলগীয়া হোৱা নাই তেওঁ সুস্থ হৈ আছে
Nagaland's Health Minister S. Pangipom took to Twitter to confirm the first COVID-19 positive case in the state. Unfortunately, one person from Dimapur has tested positive for COVID-19 and is under treatment at GMCH at Guwahati. Anyone who came in contact with the person will be immediately quarantined. Also, certain locations will be sealed for general safety, he tweeted. Nagaland Minister for Higher and Technical Education Temjen Inna Along tweeted saying, and I quote, "It is unfortunate that COVID-19 has infiltrated Nagaland. I appeal to the citizens not to panic but be extra careful and follow strict hygiene and social distance," unquote. Nagaland doesn't have a testing laboratory for COVID-19 yet, but samples collected in the state are sent to Assam for tests. This has created a lot of uproar in the social media, with many questioning the reasons for Nagaland not having even a single testing lab for COVID-19, although months have passed since the virus was declared by the World Health Organization as a pandemic. Meanwhile, as this news broke yesterday, an emergency meeting was held at the Chief Medical Officer's office, Dimapur, in the wee hours this morning. The meeting was attended by S. Pangyupom, Minister Health and Family Welfare, Special Committee Member for COVID-19 Dimapur Y. Kikheto Sema, Deputy Commissioner, Commissioner of Police, CMO Dimapur, Medical Superintendent, medical officers and staff. After threadbare discussion, the case history of the patient revealed that the patient had arrived from Kolkata by Air India flight number 709, seat number 5B on 24th March 2020. The following decisions and actions were also taken at the meeting. The entire Marwari Patti and Gora Patti area has been sealed. The parents and family members of the patient who are presently in Guwahati are undergoing necessary tests. Members of the joint family of the patient have already been shifted to government quarantine center. The private hospital where the patient was undergoing treatment in Dimapur has been sealed. The doctors, nurses and all other staff and the family members who came into direct and indirect contact with the patient to be quarantined. Contact tracing has been started for all those passengers who were on the same flight taken by the patient, Air India 709, on 24th March 2020. Although the 14-day quarantine period has elapsed on 6th April 2020, yet owing to the current emergent situation, all those passengers are directed to immediately report to their respective district surveillance unit, CMO office, wherever they are located, in order to check their health status for necessary action. The contact numbers of District Surveillance Unit Dimapur are 7630-877-991 and 7630-877-983. The entire Marwari Patti and Gora Patti has already been sealed. The wholesale market at GS Road, Dimapur and retail shops at Marwari Patti and Gora Patti will be closed until further order. The members appeal to all citizens not to panic as necessary precautionary measures are taking place to tackle the current situation and to extend the support and cooperation towards the authorities. Meanwhile, Nagaland Minister for Health and Family Welfare Pangyupom has written to the State Chief Minister Nipirio to extend the total lockdown in the state, particularly Dimapur district, with immediate effect. This letter comes after Nagaland recorded its first confirmed case of coronavirus yesterday. The Health and Family Welfare Minister has requested the Chief Minister to examine the case and issue necessary directives for implementation of total lockdown in the state in the interest of public health and safety. The death toll due to the novel coronavirus pandemic rose to 308 on Monday after 35 new fatalities were reported, while the number of cases climbed to 9,152 according to the Union Health Ministry. The number of active coronavirus cases stood at 7,987. As many as 856 people have been cured and discharged, while one had migrated. The total number of cases includes 72 foreign nationals according to the ministry data. 35 deaths have been reported since Sunday evening, of which 22 were reported from Maharashtra, 5 from Delhi, 3 from Gujarat, 2 from West Bengal and 1 each from Tamil Nadu, Jharkhand and Andhra Pradesh. Prime Minister Narendra Modi will address the nation at 10 a.m. tomorrow. He is likely to announce decision on whether the coronavirus lockdown will be extended. Assam on Monday reported another COVID-19 positive related to Nizamuddin religious congregation in Delhi, taking the state tally to 30. The fresh case has been reported from Dhubri district. Assam Health Minister Himanta Biswa Sarma said the new case is connected with Tablighi Jamaat at Nizamuddin Markaz.
Baki keta negative 34 মাত্র স্যাম্পলের রেজাল্ট আমি পাবো বাকি আছে তাহলে if we look at the Nizamuddin event that out of 1421 only 34 results are on the audit now.
The United States has recorded 1,514 virus deaths in past 24 hours according to Johns Hopkins University data. The number of fatalities is lower than the previous day's toll of 1,920. At least 20,020 deaths have been reported in the US, which is the most of any country. Let's now take a look at some of the news that's coming from the districts in Nagaland.
Has also gotten in touch with him. So the patient has been kept in the isolation and he is being monitored very carefully. But as of now, that is the status of the patient. So the doctor had informed me that the patient is critical but stable. And as far as the details of how he had been referred, why he had been referred, on what grounds he has been referred, all this, the report is being awaited, which we are expecting by afternoon. Patient may not have revealed or disclosed his travel history to the health workers when he had visited the private hospital. Now, probably we are, like I said, waiting for the report. So whether the health authorities have asked him about all these details, that we will get to know. So a statement from the private hospital may also come out. So they will be in the best position to explain whether they have asked him, whether they have prodded him, all this. But from what we could understand, those details were not disclosed, that he had a travel history. Now, we are also made to understand that this gentleman may have visited a couple of private clinics in Dimapur before he visited the Zion Hospital. So we are also tracing those hospitals and trying to find out on which exact date he visited and which doctors and which healthcare workers or nurses and also staffs and other things, other people who actually came in contact with him.
Well, that's all we have for you in this edition. We'll see you some other time with lots more. Meanwhile, stay home and stay safe. From all of us here, it's bye for now, and thanks for watching.